Definition of brainstem death. According to Royal Colleges of UK, brain death is defined as irreversible loss of capacity of consciousness combined with irreversible loss of capacity to breathe. In brainstem death is medically and legally defined as total and irreversible cessation of all brainstem functions. The declaration of brainstem death is required to disconnect patient from artificial ventilation and to ask legal consent for organ donation from the relatives. Next question is differentiation between vegetative state and brainstem death. The location of lesion in the vegetative state is cerebral cortex, and the brainstem is intact in vegetative state. In brainstem death, there will be a brainstem lesion that is in midbrain, pons, and medulla. Presentation in vegetative state, patient will be awake with cycles of eyes opening and closing, but patient will be unaware. In case of brainstem death, the patient will be in deep coma because of the lesion in reticular activating system. And then coming to respiration, in vegetative state, the patient will maintain spontaneous respiration. In case of brainstem death, there will be a loss of spontaneous breathing. Coming to circulation, the patient will be stable in vegetative state. In brainstem death, there will be fluctuation of BP. Coming to cranial nerves, all the cranial nerve function reflexes are preserved in vegetative state. In case of brainstem death, there will be loss of cranial nerve function and reflexes. Condition in vegetative state is known. The patients are not in need of life sustaining treatment, that is ventilator or vasopressor support. They require nutrition and hydration. Whereas in case of brainstem death, the patient need life sustaining treatment, that is ventilator and vasopressors. Recovery may occur, though very rare, with vegetative state. In case of brainstem death, it is irreversible and incompatible with life. Diagnostic criteria. Two examination is required for declaration of brainstem death, 6 hours apart, and should be diagnosed by 2 or 3 physicians independent of transplant team. And at least one physician should be specialist in neurology, neurosurgery, or anesthesia. Cessation of all brainstem function is determined by loss of consciousness,
Shobika, can
loss
you
of brain.
increase the volume a little bit?
Yes, sir. Okay, sir. Shall I start, sir?
Yeah.
Yes, sir. Uh, Cessation of brainstem function is determined by loss of consciousness, loss of brainstem function, apnea test, and confirmatory test. Next question is on apnea test, sir. Apnea test is mandatory for determination of brain death. It should be performed as the last test after other tests fulfill brain death criteria. The main objective of apnea test is to prove the absence of respiratory control system reflexes in the brainstem when intense physiological stimulation to breathing takes place, which is increased in PaCO2 and decreased in pH, which will stimulate the medullary respiratory chemical centers. Interruption of apnea test is if there is any absence of respiratory efforts in response to hypercapnic or acidotic stimulation, it is called positive apnea test. If there is spontaneous respiratory efforts in response to hypercapnic or acidotic stimulation, it is called negative apnea test. Prerequisites for apnea test. The core temperature of the patient should be greater than 36.5 degrees Celsius or 97.7 degree Fahrenheit. Warmers can be used for this. Euvolemia or positive fluid balance should be maintained in the past 6 hours. And systolic BP should be greater than 100 mmHg. We can do it with the help of, we can adjust it with the help of vasopressors. And eucapnia should be maintained, that is PaC2 of 35 to 45 mmHg. We can adjust the ventilatory settings. And then we have to pre-oxygenate with 100% O2 for 10 minutes to achieve PaO2 as greater than 200 mmHg. And then we have to obtain a baseline arterial ABG, and we have to adjust the PEEP of 5 centimeter of water. So coming to the procedure, we have to disconnect the patient from ventilator. We have to place a insufflation catheter into the ET tube up to carina, and we have to deliver 100% O2 at 6 liter per minute. And we should watch for respiratory movement for 8 to 10 minutes. ABG should be taken after 8 to 10 minutes. If respiratory movements are absent at PaCO2 of 60 mmHg or greater than 20 mmHg from the baseline normal PaCO2, it is interrupted as apnea test positive. If the test is inconclusive, test can be repeated for 10 to 15 minutes after pre-oxygenation. And then brain state certification is given by the medical superintendent or in charge of the hospital, independent specialist, either physician or surgeon or intensivist, neurologist or neurosurgeon, or doctor under whose care the brainstem death has occurred. That's all, sir.
Okay. You know what is the legal time of death?
After the first confirmation test, sir.
The time after first confirmation of brain death is
Confirmation.
called legal time, even though it is disclosed only after the second confirmation. Okay, so that's called that.
Yes, sir.
Did you mention anything about the brainstem testing? How it is done, the various cranial nerves?
No, sir. My question was definition, difference between and apnea test, sir. Shall I mention now, sir?
No, that was there now. How do you diagnose brain death? Was not there.
I mentioned the diagnosis, it is two examinations required, 6 hours apart, and then it is diagnosed by 2 or 3 physicians independent of the transplant team, and at least one physician should be specialist in neurology or neurosurgery or anesthesia, sir.
That is personnel who are examining that, but what about the test that you have to do to confirm the brain death?
Cranial
Cranial
nerve
nerve
examination,
examination.
sir. Yes,
That
sir.
you have to what? Which are all the cranial nerves which are not tested during brain death testing?
Cranial nerve 1, 4, 1, 4, 11, 12, sir.
11, 12. So, what is oculocaloric reflex?
Sir, oculocaloric reflex is the caloric test, sir. We instill 50 ml of ice cold water in the external artery meatus, sir. There will be a movement of eyeballs to the opposite side in case of positive test, sir. As in if the patient is alive.
Opposite side or same side?
Opposite side, sir.
So, what are the prerequisites before you do the test?
Rule out tympanic membrane perforation, sir.
Rule out
Tympanic membrane perforation.
tympanic membrane perforation. More than that, most common thing, ear wax. That will not give you the correct result. Okay? So you must rule
Yes,
out
sir.
wax in the ear before
Yes,
you
sir.
do the test. Okay? Or any other
Yes.
infection, which may be
Yes,
having a pus which will block the test doing that done. Okay? So
Yes,
this
sir.
is a very common question. So you have to be prepared. Again, I will just share the presentation quickly. We'll see.